In terms of my patient, I've had so many conversations about what matters to her, and if I look at 5-10 years ahead, I will be having the same conversation with her about what issues she needs and what we need to address, and nothing will change. Whereas I feel her life has changed, and that for me has been amazing. I mean, really. Just considering someone who may have significant mental health issues or physical issues, who may not consult because they feel, what's the point? Nothing changes. Those are the ones that could really make a difference for as well. I think there's something to be said about having a previous therapeutic relationship with a clinician, so whether that's a GP or a nurse, that gives a foundation for those conversations and trust before you even start. And I think some of the more complex patients, I think social prescribing has a benefit and a need within the team, but it may be that some of those patients perhaps need more of an in-depth therapeutic relationship to found those discussions. But I think a social prescriber is very important to want to be part of the team. And it may be that for some patients, particularly with our social prescriber here with Barnstable Alliance, she's worked with a lot of our clients and patients, and she spends a lot of time with them. And it may be that for her, for a patient, she may be that key individual to have those conversations. I think it just depends on the person, the patient, and the social prescriber. It doesn't just have to be GPs. I think there are lots of clinicians in our teams that are very well placed and able to have these conversations, and actually maybe the better person to have these conversations with some patients. And that may be a practice nurse, it may be a diabetic nurse, it may be a social prescriber. So I think it's really important to be mindful that other clinicians can do it and can do it really well. I think the resources that have been formulated for us having these conversations is really, it explains it a lot, explains everything you need to know. And once you've kind of done it once, and it makes total sense. It's not difficult. So Anna is flow coordinator for, I think, well, certainly for my patient, and I know for others, and she's been key in managing us in terms of getting us to, inviting us to the meetings, getting the right day and date that suits, particularly the client and the main individuals in the meeting. She's been amazing at adding the notes from the meeting and any actions, and just keeping us kind of ticking along. So that's been brilliant. And actually having that and not having to think about what else needs to happen because she's doing that it's been phenomenal. From the flow meetings we've had with my patients, so there's been myself as her GP, there's been Ella McGann, who's a community connector, we've got Anna, who's our flow coordinator, and we've also had one of the pain team clinicians join us, one of them. And we're likely going to have a social worker and a housing officer come to the next one. To see it's been phenomenal for me. As her GP, it's really changed her life. And I would never have had this time and the help from the team to do that. And I've had similar conversations with her, not as extensive conversations, over 10 years, and we've never got to this place before. And it has literally changed her life and the grandchild's life. And I could cry talking about how amazing it's been for her. So if anyone has any concerns, any sort of worries that that this approach doesn't work, that it takes too much time, just think again. Think about those patients that you see regularly and you don't get anywhere. What could you do to help them? And yes, it might take up a bit more of your time, but actually it makes a huge difference to patients' welfare and outcome.